Here's one of the worst things you could do for your shoulder. Don't make this mistake. In this video, I'm gonna teach you the best exercises you could do for your shoulder. What's up, Dr. Nick Bonforte here. So in this video, we are going all over the shoulder complex. Now, commonly, when we have shoulder issues, it's really related to the shoulder impingement. So when we think about that, we have to think about, okay, what does that even mean? We have to consider all of the structures around the shoulder that can contribute to impingement. When we raise our arm upwards into flexion, we move it backwards or up to the side, we are impinging structures. It's just whether it's asymptomatic or symptomatic. So we have to think about what structures can get impinged and what things lead to an increased likelihood of getting impingement. We have the skeleton model here, and then we're taking a shoulder off of it to get a better view. So when we're thinking of the shoulder, we have the shoulder blade and then the arm bone. And we have rotator cuff muscles on the back, which is the infraspinatus and the teres minor, the top, which is the supraspinatus, and then in the front, which is the subscapularis muscle. All those are rotator cuff muscles that attach to the shoulder bone. And these muscles have tendons that go into the shoulder bone right here, into the arm bone. Now, when you move your arm up, those tendons can get impinged. That could be one source of an impingement type of source of pain, rotator cuff tendon impingement that are causing the issues. You also have a bursa, which is a fluid sac in the shoulder joint that helps basically lubricate the joint. When you raise your arm up in all different directions, if that's inflamed, it could be impinging on that, causing some of the issues. Whatever the case is, impingement is just when these structures are symptomatic when you're actually going to the motions. So we have to think about contributing factors. It could be strength, it could be range of motion, it could be movement mechanics, it could be repetitive positions that you're getting into. The idea is to figure out the likely contributing factors and then address them. So let's get into some exercises to fix this. Now, to see if you have to work on the back of the shoulder, the posterior capsule, you want to address shoulder internal rotation and see where you stand. Because if that's limited, you can kind of actually relate it to a contributing factor to why it hurts when you raise your arm up, because the posterior capsule isn't flexible enough. You improve that, it will help go up into overhead flexion. So we have to look at a test of shoulder internal rotation to see if this is limited, because these muscles do shoulder external rotation in the back of the shoulder. So if they're stiff and tight into external rotation, it will limit your ability to go into internal rotation. And if it does that, it gives you insight. You have to work on that. Hey, real quick, if you're liking this content, I would really appreciate it if you hit that subscribe button. It really helps out with my channel, and I really do appreciate it. All right, back to the content. Lying down, you put your arm and shoulder at a 90-degree angle. So 90 degrees at the elbow, 90 degrees at the shoulder. So the elbow is right out in front of the shoulder, right onto the outside. From here, you're gonna go downward into the arm until you feel one of two things, actually one of three things. One, you feel stuck, like you can't go any further. Two, as soon as you start to feel like your elbow's dropping to get down further, that's when you would stop. Or three, your shoulder will just pop up like this. That's just the compensation. So you want to think about your shoulder being down into the ground. From here, you just want to move to the motion. You want to think about just rotating downward as far as you got and stopping when you feel stuck without popping up the shoulder and without dropping the elbow. So you just go to the point where you're like, okay, right around there, I feel stuck. And if I go any further, I'm gonna drop my elbow or pop up my shoulder. That'd be a compensation. So you just wanna move into the motion that you actually have and then address it from there. And what we're looking for is anywhere from 60 to 70 degrees of shoulder internal rotation. If this is 0, you want to go down into about a 60 to 70 degree angle without those compensations to actually see if it's actually good range of motion. If you lack that range of motion, that's when you know you got to work on this. Working on this stretch will be crucial for the posterior capsule. It's a simple cross-body stretch with a scap squeeze. And what this does is target the back of the shoulder way more effectively than a lot of other things trying to address this. So you want to start here, especially when the shoulder is symptomatic, because it's very low level, it won't aggravate things, and you'll get a lot of results from this. So from here, your arm is straight, you're gonna pull it across your body until you feel a light stretch to the back of the shoulder. From here, once you feel that stretch, the idea is to not just rip your shoulder blade along for the ride, but just go into a stretch, and then once you do feel that, you wanna think about squeezing your shoulder blade down and back. while keeping your arm in this position. So I go here, I squeeze down and back, and when I do down and back, I immediately feel an increased stretch to the outside of my shoulder. Once you do feel that, you would then hold it. Minimum that I like to do, especially starting out, is about a 30-second hold, and then you relax, and then you repeat about, say, 4 cycles. 4 cycles because you get about 2 minutes of time under tension. You want enough time under tension to actually make an actual effect into the area that we're going to address. What this does over time, when you do consistency to this, it gets the posterior capsule more extensible and more flexible. Then over time, you'll be able to get more extensibility to that capsule so that when you raise your arm up, it can move backwards as it should when your arm goes overhead, leading to less likelihood of issues at the front of the shoulder. After working on the back of the shoulder stretching, we want to put that area under a lengthening motion with load, so eccentrics. So with this exercise, we're gonna be using a light dumbbell. This doesn't have to be a dumbbell, it could be an ankle weight on the wrist. You just wanna apply the concepts here. We wanna stretch out the back of the capsule in a lengthening motion. So from here, we can come here like this and slowly drop the dumbbell down, which stretches all of the back of the shoulder eccentrically. Then we bring it back, come up to a start point, punch out, and go down nice and slow. What you'll feel is the back of the shoulder kind of burning and working, but this is working under a lengthening motion, which is eccentrics. Eccentrics are super important to actually build length in the tissues. It builds and it contributes to sarcomeres in length, which is actually getting the tissue more extensible. So you do this one again over time. Typically, I like to start with eccentrics, anywhere from 3 sets to about 15 reps to get more input to the system to then get more flexibility to the back of the shoulder. A thing you want to be aware of with this one, when we're dealing with shoulder impingement, is not to start too high and go down. You want to start within a range, typically below the shoulder right here, and as you drop, you come forward a little bit to actually stretch it, versus just hammering into a range of motion that is painful. So you want to work into ranges of motion and really apply the concepts of getting it under load in a comfortable position. Now, after those first 2 exercises, we want to work on activation into a lengthening motion. Remember, we're working on the lengthening of the posterior capsule, which is going into internal rotation. So we have to work into that motion on stretch. So a simple thing we could do is just put our hand behind the back, squeeze the shoulder blade back, and then from here, we want to work on just lifting off the back. Now, we have to keep in mind, when we're dealing with impingement-like symptoms, shoulder issues and pain will be uncomfortable to reach behind the back. Now, I'm not saying you should just crank your arm behind your back and start lifting off and contribute to the issue. But after those first 2 exercises, you could definitely get in a position of comfort and work into your range of motion, which then prepares the shoulder to be in that position. You do that consistently over time, you can get higher and higher and higher and get a healthier shoulder versus just avoiding the position. So you really want to play within your range of motion and not just hammer it. So from here, imagine if I go like this hurts being here, but going down right here feels fine. So you would then work into this position after those first 2. So from here, the shoulder goes back, so it's not compensating and dumping forward. So it goes back a little bit. And then from here, I'm just gonna lift off and hold. Typically, I like to get a little bit more time under tension with this. So I hold it for 5, 4, 3, 2, 1, and I come back down. Shoulder back, hold that position, lift off. 5, 4, 3, 2, 1. And I would build up to about 8 reps, 10 reps, a couple rounds to get more input into this area. So again, this is working on putting all the posterior capsule and the things that limit internal rotation on stretch, and then working into that position with shoulder IR liftoffs. So hopefully this all makes sense, and these concepts from step 1 to step 3 in this exercise make sense. I really hope you understood and got some good takeaways throughout this video, and really peeled back the layers to figure out contributing factors to why shoulder impingement happens and why you can't just overhead smash your arm into more mobility and just push through the pain. You want to think about other factors that contribute to this. In this case, we focused on the back of the shoulder, the posterior capsule, of why if that's limited, it can lead to these issues. So I really do hope you gain some value in this video and have a better outlook on how to address this shoulder issue. I would really appreciate it to help out the channel if you smash that subscribe button, like this video, turn on post notifications, comment below whatever you liked best about this video, whatever exercise you liked most, and I'll see you next time. This is Dr. Nick. Thank you.